Hi, this is Lloyd again, and in this video I'll be talking about the suspension of the upper limb from the trunk and the transmission of force in a closed pack position of the upper limb. So, in a nutshell, there are three mechanisms for suspension of the upper limb from the trunk. The first is from the trunk to the clavicle. The second is from the clavicle to the scapula, and the third is from the scapula to the humerus. First of all, we're suspending the clavicle, we're then suspending the scapula from the clavicle, and then we're suspending the humerus from the scapula. So the first mechanism being from the trunk to the clavicle. So we have the sternoclavicular joint, which is helping to contribute to this, particularly the really strong interclavicular and costoclavicular ligaments that we talked about in a previous video. But we've also got this muscle here, the trapezius, or more specifically the superior and some of the middle fibres of trapezius. So trapezius is a very broad superficial muscle of the upper limb, and because of its broad origin on the spinous processes of the vertebral column, it can have a variety of different actions. So the trapezius can move the scapula upwards or elevation, it can retract the scapula, the inferior fibres can depress the scapula, and it can also rotate the scapula so that the glenoid fossa faces more superiorly. Now, the parts of trapezius that are going to be involved in limb suspension are these superior fibres here, which are holding up the scapula. So the fibres that are responsible for elevation and partially also of retraction will be the primary fibres involved in limb suspension. The second mechanism of suspension is from the clavicle to the scapula. And this is achieved through a couple of very strong ligaments, the corticoclavicular ligaments. Now, as I say, there are two corticoclavicular ligaments. We have the conoid ligament more medially and the trapezoid ligament more laterally. And of these two, the conoid ligament is actually the one that has the most tensile force passing through it to suspend the upper limb. However, the trapezoid ligament will also be involved in this. So looking at a diagram from your prescribed textbook, with our clavicle and our coracoid process here, these are our two corticoclavicular ligaments. Conoid more medially and trapezoid more laterally. And we can see that the conoid ligament is actually slightly spirally shaped, and this allows it to unwind somewhat during suspension of the upper limb. Allows just a little bit of separation between the scapula and the clavicle. And together these corticoclavicular ligaments are responsible for preventing the separation of the clavicle and the scapula during the suspension of the limb, so that the clavicle and the scapula move as a unit. And our third mechanism of suspension of the upper limb is from the scapula to the humerus. So these will be the ligaments supporting the glenohumeral joint, particularly the superior part of the glenohumeral joint capsule. There are a couple of ligaments involved in this. We have the coracohumeral ligament running from the coracoid process to the greater tubercle of the humerus, so across the superior aspect of the glenohumeral joint, and the superior fibres of the glenohumeral ligament itself. So looking at diagram again, we have the glenohumeral joint with the fibrous capsule arching superiorly, the coracohumeral ligament, and the glenohumeral ligaments more anteriorly. Now, the primary role of all these suspension mechanisms is to allow us to use our upper limbs for manipulation of the environment around us. So they're suspending the entire upper limb off of the trunk. But the upper limb can also resist compressive forces. So if we fall, for instance, or doing push-ups, the force is going to be relayed from our hand to our trunk, hopefully without doing any damage along the way. So if you're laying down and you try and push yourself up off the floor, the force is going to follow this pink line. And the force will initially start off on the ball of the hand. And this force will then cross the carpal joint onto the radius. Now the force from the radius will then cross the interosseous membrane to the ulna. And this is because the radius is enlarged distally while the ulna is enlarged proximally. Crosses the elbow joint onto the humerus, continues its way along the shaft of the humerus, and it then passes across from the head of the humerus to the glenoid fossa of the scapula. From here the force will go from the glenoid fossa up the coracoid process, up the trapezoid ligament onto the clavicle, and along the shaft of the clavicle and across the sternoclavicular joint into the trunk. Now it looks as though this force is somehow managing to go around corners, but in reality this isn't the case, because in a weight-bearing situation such as a push-up or during a fall, the limb is usually abducted, flexed and pronated. So what appears to be a bent line here is actually going to be a straight line of force transmission from the hand all the way up to the sternum, or at least close enough to being straight that it's not going to cause a fracture of any of the bones along the way. So in this inset diagram here of the guy that is falling, we can see the force is going directly proximally up the shaft of the humerus and across the glenohumeral joint onto the scapula, and the clavicle is aligned in that same direction, so the force is all passing in a straight line. Now you can read more about the suspension of the upper limb and the transmission of force through the upper limb, so the difference between tensile and compressive forces in the upper limb, by consulting your prescribed textbook, the Principles booklet and your study guide. This has been Dr. White. Thanks for taking part.